Hi, I'm Kristen Apple from Applepuncture. Today I wanted to talk a little bit about migraines. There are a lot of different types of headaches, and we're going to focus specifically on migraines and how Chinese medicine understands migraines. I myself have had major challenges with migraines in my life. I am doing well these days. But I can really empathize with those who are struggling with a migraine. If you aren't sure whether you've had a migraine, you probably have not had one. They are really, really awful and kind of debilitating, really hard to do anything when you have a migraine, including sleeping. It's hard to even get good sleep when you have a migraine. So what causes a migraine from a Chinese medical perspective? There could be different reasons for a migraine, different meridians involved, especially if we're just talking about headaches in general. There could be very different things going on that could contribute to why a headache is happening. But when we're talking about migraines, there's often a very upward surge of energy, like an ungrounded yang energy moving up to the head, yang being the energetic, uprising, masculine principle in Chinese medicine. There's not enough grounding, possibly enough good, rich blood holding the energy, and so there's like an upward rising movement. That could be caused by different things, but what I see a lot in clinical practice is there's a combination of things going on that is I see repeated. So there may be a sort of blood deficiency, meaning the person is not getting enough blood building, nutrient rich food. It may not show up in regular blood work as anemia, but it's just not enough blood volume filling the body, and so you're not feeling grounded in the body. You're feeling restless. And then combined with often emotional triggers, hormonal triggers, food related triggers, blood sugar issues, all of these things often combine to contribute to the perfect storm when a migraine occurs. But there's the emotional side of it is pretty huge. And one of the things that I don't know that a migraine would happen as much, even with these other combined factors, if there wasn't this energetic issue on the emotional subconscious level. And that I see often, myself included in the past, is a sort of drivenness that is not even necessarily it may have come from somewhere else when you were a child, and there's this kind of push-pull interaction going on. Some part of you, maybe your truer nature, doesn't really want to be pushed the way that another part of you is pushing, and so there's a resistance going on. Maybe there's a rushing, a pushing, to be very on, to be very productive, to perform. And another part of you is wanting not to do that. Another part of you is perhaps wanting to rest or be softer. And, so there's this push-pull going on, and that I think is a major contributor to migraines in a lot of people. So let's see. So that I would consider emotional stress. We talked about hormonal factors. Absolutely, that can be a big part of it. So a lot of times when a migraine actually happens, you'll notice with yourself that you may have that emotional stress going on, and maybe you'll catch it in time. But if you have any of these other things occurring all at the same time, then you probably will end up with a migraine, or you've noticed that happens. So you're having a hormonal thing going on, you are sensitive to foods, certain foods bother you, or preservatives. Caffeine is a huge contributor. It's a tricky one because caffeine can, once you have a migraine, can sometimes help get rid of the migraine. But if you're doing this a lot, it can actually start to become a sort of loop. I found that eventually, if I had too much caffeine, I started getting migraines with caffeine. So I had to just totally back off of caffeine. Dehydration. So you know, if you're not hydrated and then you're also kind of like stressed out, you might get a migraine. Missing a meal, so like blood sugar levels or too much sugar could definitely irritate, stress the body, and then bring up some of that discomfort and then lead to a migraine. You may also notice barometric pressure shifts majorly impact the likelihood of getting a migraine. Overexertion, loud noises, exposure to smoke, perfumes, dry heat. You know, like we have our heat on now, and the dryness can really like kind of impact this whole area, causing also kind of like a rising of heat toward the head. Certain medications can cause blood vessels to swell as well. So what do we do to change this? What can we do to reduce migraines? In Chinese medicine, we often will use acupuncture, herbal medicine. We might use cupping and gua sha to help relax and create blood flow and circulation to the tight muscles, particularly in the scalenes, the occipital region, the trapezius, and the jaw. So, and the sternocleidomastoid, the SCM. The meridians that we often find are most involved are the liver, spleen, and kidney meridians. The liver is major contributor to migraines. When the liver blood is not nourished and it's not flowing smoothly, there will be a blockage, and there may be like an accumulation of qi in the liver gallbladder meridians, called the Xiaoyang zone, and then also in the bladder kidney meridian. So like the bladder meridian, the yang side of it's basically the whole back. We call it Taiyang zone, and small intestine is also part of Taiyang zone. These are zones of the body. They're kind of like, you can think of like the armor of the body. We have this side thing that happens along the sides, going up the neck and down the IT band and all of that, and then we also, and kind of like wrapping around the head. That's the big part. This is Xiaoyang zone. We also have Taiyang zone, which is the whole back side of the body coming up by the occiput. And these are the major areas of migraines. And so a lot of people find that acupuncture hugely helps their migraines. It smooths the flow of qi and blood in the body. It helps to break up any blockages in certain areas where we are holding on to the qi and the energy. And it helps to increase and nurture areas that are deficient, that are tired and not getting enough love and attention and energy and vitality. So that's, I would say the acupuncture is probably I feel the deepest impact in terms of helping migraines. Herbal medicine may be necessary, like on an internal level, to help rebuild the blood, and also we have certain formulas that help to continue to promote that smooth flow in the body. So that's just a brief introduction to how acupuncture helps. We would recommend for chronic migraines 1 to 2 treatments per week. Usually 1 treatment is fine for 6 to 10 weeks. We may recommend nutritional changes. We want to keep your blood sugar at a more level, at more level rather than spiking constantly. And exercise can help a lot too, to get that movement going of qi and blood. And good sleep, these kinds of things are important. All right, feel free to reach out if you have any questions.